I think the reality is that we're still very far from ending new infections in children. If you look at the data, it's clear that our progress has flatlined. We still have over 160,000 new infections in children every year. There is a huge gap between children and their mothers with respect to access to treatment.
Many communities are faced with real structural barriers: stigma, discrimination, punitive laws, violence, social, cultural, gender inequalities.
Frontline healthcare workers are the critical piece of the puzzle that's been missing in solving the crisis of pediatric HIV infections.
They're the ones who drive this movement to end AIDS.
We believe that we can have all the health systems we need, we can have all the drugs we need, but without trained, capacitated health providers, we will not be able to achieve our goal.
And PATA stands out for that reason alone, in just focusing on what's needed to actually provide care.
The health provider situation in many countries in Africa is a concern. And PATA presents an opportunity for these health providers to provide stories of the real situations they're facing on the ground.
We want to look into a different perspective for them to voice their feelings, their stress, their challenges.
They're working under extremely difficult circumstances. It's demotivating to work in a broken health system. It's frustrating to watch patients get sick. It's frustrating to watch patients die, especially when they're children. Healthcare workers have the right to be compensated for their time. They have the right to work in a safe and supportive environment. To me, it's critically important that PATA's mission of supporting and sustaining frontline healthcare workers is recognized.
We cannot make policies without understanding what health providers' needs are.
To be able to have the voices of the frontline health providers influencing decisions at the top levels of national and global policy, and to link on those policies to the front lines of health is one thing that I haven't seen as effectively implemented than by PATA.
So the Global Alliance is a recently launched collaboration. The Alliance is coming together with countries to try to tackle 4 areas where we want to see progress happening.
Through this Global Alliance of Ending AIDS, we need different stakeholders, and frontline health providers are most important. If we are leaving them behind, I don't think we are going to reach there in our targets.
What we really need to get right is the integration of HIV services into primary healthcare settings.
A huge part of that health system are the frontline healthcare workers. If we're not supporting them, we don't have a healthcare system.
And it's therefore critical that we acknowledge, celebrate, support, and value the work of frontline health providers, and make sure that we are providing sufficient investments directly to the frontline.